Opioid crisis public service announcement. Opioid use disorder, sometimes referred to as opioid abuse or dependence, or opioid addiction, is a problematic pattern of opioid use that causes significant impairment or distress. In the US, nearly 500,000 people died from an opioid overdose from 1999 to 2019. This rise in opioid overdose deaths can be outlined in three distinct waves. The first wave began with increased prescribing of opioids in the 1990s. Pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This subsequently led to widespread misuse of these medications before it became clear that they could indeed be highly addictive. The second wave began in 2010 with a rapid increase in overdose deaths involving heroin. The third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, specifically illicitly manufactured fentanyl. Prescription opioid pain meds such as oxycodone and hydrocodone have effects similar to heroin. Research suggests that misuse of these drugs can open the door to heroin use. About 80% of people who use heroin first misuse prescription opioids. This graph shows rates of overdose deaths associated with three categories of opioids, as well as all opioids overall. Prescription pain relievers include oxycodone, hydrocodone, codeine, morphine, and others. Synthetic opioids include fentanyl, methadone, pethidine, tramadol, and carfentanil. More than 80% of drug overdose deaths involved opioids, and nearly 85% of overdose deaths involved illicitly manufactured fentanyls, heroin, cocaine, or methamphetamine alone or in combination. Most overdose deaths involve one or more illicit drugs and can be found in many different combinations. Illicitly manufactured fentanyls are 50 times more potent than heroin and 100 times more potent than morphine. The market for fentanyl continues to change, and it can be found in combination with heroin, methamphetamine, cocaine, marijuana, and counterfeit pills. In most overdose deaths, at least one of the following circumstances are identified to be present, and each of these can impact the risk of overdose and represents a potential touch point for linkage to care. These can include a recent release from an institution, a previous overdose, a mental health diagnosis, previous treatment for a substance use disorder, and nearly 40% of opioid and stimulant overdose deaths occurred while a bystander was present. When risk factors for drug overdose are present, overdose deaths can be prevented by using the following strategies, such as enhancing linkage to care, including mental health and substance use disorder treatment and support services, increasing access to risk reduction services, reducing high-risk drug use by improving prescribing practices, and increasing distribution of and access to naloxone, especially for bystanders who may be able to reverse an opioid overdose. Naloxone is an opioid antagonist that can quickly and safely reverse the potentially fatal effects of an opioid overdose. It can be given as a nasal spray or injected into the muscle, under the skin, or into the veins. It's a drug that carries no risk of abuse and has no effect on individuals who don't already have opioids in their system. It does not generate physical dependency, and it produces no neurological or psychological effects or euphoria. It also poses negligible risk of harm if misused. The people who most often witness and respond to an overdose are often other people who use drugs. By equipping these individuals with naloxone and training them to identify and respond to an overdose, the potential delay between the onset of an overdose and the delivery of life-saving care can be reduced from hours to seconds. The signs of an overdose may include blue fingernails and/or lips, unresponsive to voice or touch, constricted, small pinpoint-sized pupils, slow heartbeat or low blood pressure, slow, irregular, or halted breathing, pale, clammy skin, choking or gurgling sounds, and or a limp body. Recognizing opioid overdose can be difficult. If you aren't sure, it is best to treat the situation like an overdose because you could still save a life. Call 911 and do not leave the person alone. The term 911 Good Samaritan Law refers to a local or state legislation that provides overdose victims and/or bystanders protection from drug possession charges. The scope of 911 Good Samaritan laws varies across the United States. but each is written with the goal of reducing barriers to calling 911 in the event of an overdose. Since the first reported case of COVID-19 in the US in January 2020, suspected overdoses increased 20% over a 3-month period compared with the year before. Opioids accounted for around 75% of all overdose deaths during the early months of the pandemic, and around 80% of those included synthetic opioids such as fentanyl. More than 40 states have reported increased opioid-related mortality during the pandemic. The opioid crisis has been exacerbated by COVID-19, but prescribers can be part of the solution. They can start by prescribing non-opioid pain relief whenever possible. If opioids appear to be necessary, they can begin with the lowest effective dosage and a short-term prescription. They must check their state's prescription drug monitoring programs to monitor their patients' prescribing activities. And to better minimize risk of patient death, they can avoid prescribing benzodiazepines along with opioids. Together, we can fight the battle of this opioid epidemic. Together, we are making progress. Thank you.